Most people think medical emergencies require a doctor to solve. But in many parts of the world, that assumption simply doesn't hold. And when it doesn't, people don't stop having emergencies. They just handle them differently. At first, it sounds unrealistic. How can someone deal with a serious health issue without professional help? But the reality is, it happens more often than most people think. Not by choice, but by necessity. In places where hospitals are overwhelmed, under-equipped, or simply unavailable, people don't have the option to wait. So they adapt. And that adaptation starts with something most people in stable systems never develop: responsibility. When there's no doctor to call, no pharmacy to rely on, and no immediate help coming, the entire situation shifts. You're no longer just the patient. You become the observer, the decision maker, and the one who acts. And that's where the first problem appears. Because most people aren't trained to think that way. So they try to approach the situation the only way they know how. They look for quick answers. They rely on memory. They try to match symptoms to something they've heard before. But medical situations don't work well with guesswork. A small mistake early on can change everything. A minor wound left untreated properly can become infected. A fever that seems harmless can escalate. A delay that feels safe in the moment can remove options later. So people start experimenting. They use what they have. They reuse medications. They try alternatives. Sometimes it works. Sometimes it doesn't. And that unpredictability creates a constant layer of stress. Because every decision feels like a risk. And the feedback isn't immediate. You don't always know if you did the right thing until much later. That's what makes these situations so difficult. It's not just the lack of resources. It's the lack of clarity. But over time, something interesting happens. People who are exposed to these conditions regularly start to operate differently. They don't rely on random solutions. They start recognizing patterns. They begin to understand how the body responds. They pay attention to small signals most people would ignore. And instead of reacting emotionally, they start thinking structurally. At first, it's subtle. They learn which symptoms matter more than others. They learn when a condition is likely to worsen. They learn what can be handled, and what cannot be delayed. And that shift changes everything. Because now, instead of guessing, they're filtering. They're narrowing possibilities. They're making decisions based on observation, not panic. Think about something like an infection. Without structure, it's just redness and pain. With structure, you start asking better questions. Is it spreading? Is there swelling? Is there fever?